COVID-19 update.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, May the 31st. We're honored to be on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations, and honored to be here today on their lands. Tomorrow, Tuesday and Wednesday, we'll be providing written briefings on information relevant to the COVID-19 pandemic in BC at approximately 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. I would like to start today's briefing by pausing to acknowledge and to remember and mourn the children whose remains were found at the former Kamloops Indian Residential School. I struggled to find words to express my horror and grief at the discovery of these remains of 215 First Nations children. I realize it's because there are no words that can do justice to those children and the countless others who died alone and scared, far from home, far from the families who loved them. There are no words that can make right a deliberate and intentional system that was designed to assimilate and extinguish Indigenous peoples. So today I don't offer words, but rather my renewed commitment to actions that arrest and disrupt our deeply rooted ideologies of settler supremacy. We must make no mistake that while these deaths happened in the past, our systems and laws continue to perpetuate racism and discrimination that hurts Indigenous peoples in countless ways. I've stood at this podium many times as an expert in public health, and today I'm here again as a humble learner in reconciliation and decolonization. I am so grateful to the First Nations and Métis leaders who continue to share their wisdom with me as I personally work to deepen my understanding of reconciliation and the ways in which I can work to advance it. This is hard work that requires us as leaders and settlers in our systems to find the courage to accept that this is our history of colonization. It's not something that happened to First Nations children and families. This is something we did to First Nations children and families. We are all implicated in this tragedy. In order to honor the strength and resilience of survivors and descendants of Indian residential schools and the memories of all those who never returned home, each and every one of us needs to ask ourselves, what meaningful actions can we take to uphold the rights of Indigenous peoples? I'm very grateful that I have a team that is committed to this, and we will be coming together once again, reflecting on the many paths that we have forward. The Truth and Reconciliation Commission calls to action, the Missing and Murdered Indigenous Women and Girls calls for justice, the In Plain Sight recommendations that we received earlier this year, and the Declaration on the Rights of Indigenous Peoples Act. And we will hold ourselves accountable to an ongoing process of reconciliation that we have tried to mirror through this pandemic. We cannot get stuck in our shame and grief, but rather commit to ourselves, to one another, and to First Nations, Métis, and Inuit peoples that we will deliberately and intentionally take actions that will serve to heal rather than harm from this day forward. And I'd also like to start our update today with transitioning, as we are in our step one of our restart. We're going to start with the immunization progress as a positive way forward. As of this past weekend, we've delivered 3,250,116 doses of all 3 COVID-19 vaccines to adults and children here in British Columbia. And over this past weekend, we have immunized 3 million people. 3 million people of us here in BC. 179,954 people have received second doses. This equates to 69.7% of all adults 18 plus and 66.1% of those 12 and older in our province. Our vaccines, as we have come to know, are safe and highly effective, but they're not 100%, at least not yet. This is why it is incredibly important for us to make sure people get second doses, and over this weekend, over 300,000 people have now been either received or booked their second doses again. A second dose is necessary to maximize our protection and for the maximum amount of time. And this is very good news for all of us that we are on that road. We expect to receive more of both Moderna and the Pfizer vaccines in the coming weeks, and we will be moving out to communities as well to start the second dose. Later on this week, on Thursday, I will provide the details of our dose 2 approach for those who have received the AstraZeneca vaccine, and we have updates on information that so people can make the best decision for them around which vaccine they want to receive for their second dose. Going back to the other things that we are monitoring carefully, and that is cases, hospitalizations, ICU cases, and deaths. In the last 3 periods from Friday to Saturday, we had 258 new cases of COVID-19 in BC. From Saturday to Sunday, 238, and in the last 24 hours, an additional 212 new cases diagnosed. This brings our total to 708 new cases over the past weekend, and 144,289 people have been diagnosed with COVID-19 in BC. Of the new cases, 140 were people in the Vancouver Coastal Health Region, 394 people were in the Fraser Health Region, 18 in the Vancouver Island Health Region, 113 people in the Interior Health Region, 42 people in Northern Health, and 1 was a person who normally resides outside of Canada. We currently have 2,953 active cases across the province, 249 of whom are in hospital, 78 people in critical care or ICU, and 139,562 people have recovered from their acute infection. Sadly, we have had additional deaths as well from COVID-19. There were 11 new people who died from COVID-19 over this weekend, bringing the total number of people we've lost in British Columbia to 1,703. 1 was a person in their 40s, 2 were people in their 60s, 6 of these were people in their 70s, and 2 were people over age 80, reflecting again that our seniors and elders are those most affected most tragically. And our condolences and thoughts go to those who have lost loved ones. We know how challenging it is in this time. We've had new outbreaks over the weekend at Richmond Lions Manor in Bridgeport in Vancouver Coastal, and an outbreak was declared at the Iqra Islamic School in Fraser Health. The outbreak at Lions Gate Hospital is now declared over. This means we have now 6 active outbreaks, 5 in long-term care, 1 in assisted living, and 1 in acute care. I do also want to report that we've had an additional case of VIT, or the vaccine-induced thrombocytopenia, thrombolic thrombocytopenia. That brings our total to 3 cases now in British Columbia. This is a man in his 30s in the Island Health Region who is now receiving treatment and recovering in hospital. While we are making significant headway in our immunization efforts, and that is reflected in the decreasing case counts in our communities and in our hospitals, it is still a time of caution for all of us. New strains are circulating, and outbreaks are still occurring in schools, in hospitals, in long-term care, and in our communities. We are in the midst of the post-long weekend incubation period, which means anyone who may have contracted the virus at that period of time will be starting to see symptoms now. And it is important, if you have any symptoms, to get tested right away. Our testing sites are still up and running and active. You can get the support, so we can find people, we can support you to be isolated, to get the care that you need, and contain further spread. We have seen a few new outbreaks in these recent days, and we all need to take our precautions to prevent more. Using your layers of protection is something we have talked about for a very long time, and we all know they are just as important today as they were a month ago or 6 months ago. Immunizations are an extremely effective tool, and that is an important tool for us to get through this pandemic. But they are not fully protective, and they're not fully protective yet in our communities. That's why it's important we all stay vigilant so that we can prevent transmission and stop this pandemic. Registering with the Get Vaccinated immunization system is the fastest way to get both your first or your second dose, and particularly for anyone who is immunized prior to April 15th. Please go on the system and register. If you've already in there, the system will now tell you that. So there is no problem with registering more than once. And I've said this before, but it is important. We were building our registration system as we were delivering vaccine in the early parts of this immunization campaign. So anybody who received their vaccine prior to the middle of April, to April 15th, it's important for you to go and register on the Get Registered immunization site. We do have a record of your vaccination and your PHN, but what we don't have is that easy way to connect with you through text or phone. So if you're unsure, complete the 2-minute registration process, and the system will immediately notify you whether you are in there or not. And many of you who may not be aware of this will be receiving a letter from us in the next few days with the information you need as well. So it is with very mixed emotions that I stand here today. We are in the middle of step 1. Part of me, of course, is pleased that we are making progress. We've seen a dramatic decline in cases and great progress in our immunization program. But we need to continue to closely watch, and the active outbreaks and new cases make me concerned. And we, of course, are mourning for those we've lost for COVID, but also for the tragedy that we've seen unfold in our communities. We need to take this time of sadness to stand in solidarity, connect with our children, connect with our grandchildren and our families, and honor everyone we've lost in the past 15 months and in times past. Let's also take this time to learn about the tragedies of the residential schools so that we can move forward together. And let's remember more than ever when we're going through these trying times how important it is to be kind, to be calm, and to stay safe. Thank you.
Thank you very much, Dr. Henry, and I'd like to start today's briefing, as Dr. Henry did, by acknowledging the discovery of the remains of 215 children in Tecumseh Loop's Swepnik at a residential school, and the atrocity of residential schools in BC. We all, if we are human, I think, feel for the lives lost and their families and their communities, and the multi-generational trauma that continues today. And as Dr. Henry has said, must commit ourselves to action and not words, and to action with the direction and the leadership of Indigenous people in our province and in our country. I think we need to understand from a healthcare perspective that we need care that understands and supports those with trauma from residential schools. And we need to ensure our healthcare system understands and supports those with trauma-informed care, with knowledge of the history of colonization in the residential schools system and the destruction and displacement of communities. We need to act in this way. People will know that recently Dr. Mary Ellen Turpel-Lafont led her own on behalf of the government, an inquiry into racism against Indigenous specific racism in our public healthcare system. And those actions, those recommendations are being acted upon in concert and in partnership with Indigenous leaders, and we will continue to act. And I just wanted to note for everyone is, as we move through that implementation, that anyone wishing to share their experiences of racism and discrimination in healthcare may do so. There's a toll-free number, 1-888-600-3078. And I also would like people who to know that there is a national residential school crisis line that has been set up to provide support from former residential school students and those affected. Access emotional and crisis referral services by calling the 24-hour National Crisis Line, which is 1-866-925-4419. Within BC, the CUAS Crisis Line Society provides First Nations and Indigenous specific crisis line available 24 hours a day, 7 days a week, toll-free from anywhere in British Columbia. And that number can be reached toll-free at 1-800-588-8717. I'd like to start, as I normally do, by recognizing the 11 people who passed away related to COVID-19 in British Columbia this weekend. 7 from Friday to Saturday, 1 from Saturday to Sunday, 3 from Sunday to Monday. It is, of course, for them and their families and their communities and their caregivers, it continues to be a challenging time to grieve, even at this point in the pandemic, especially perhaps at this point in the pandemic. I want all of them to know that we're with them in their grieving and in their difficult moments today. With respect to the public healthcare system and surgeries in that system, you'll know, Dr. Henry's just reported that we've gone in the height of the third wave from 511 people in hospital with COVID-19 to 249, which is obviously a significant reduction, one of more than half, that we've gone from 183 people in critical care to 78 today. and that everyone in our healthcare system continues to work extraordinarily hard to support people who are dealing with COVID-19 and everyone else who needs acute and healthcare in our province. I would note that as of today, only 7 of our surge ICU beds is in operation today and is being used. A sign, I think, of the reduction in the demands on ICU related to COVID-19. However, this is a very significant and busy time for our healthcare system, and there are, in fact, more people in hospital with other conditions today than there was a few weeks ago. As we've noted, 3,250,161 doses of COVID-19 administered, 3,064,568 first doses. That's 69.7% of all adults in BC. That's 66.1% of all those eligible, meaning all those 12 and above. That's 87% of people over 70, 84% over 60, 81% over 50, 78% over 40, and 74% over 30. I'd also note that more than half of those between 12 and 17 have registered for their first dose immunization. That's 168,899, and that 3,185,217 registrations have gone through in British Columbia. I'd also note that after the announcement by Dr. Henry last week of the sending out of booking invitations for dose 2 to many people in BC, that just under 450,000 booking invitations were sent out. And as of today at 8 a.m., 381,077 bookings had been completed, either online or through our call centers. And we encourage people, of course, to respond when we ask them to book and to continue to register. And this is an important theme, that we continue to meet the test of vaccination, and that means continuing to increase our level of registration and immunization in every part of the province. I want to acknowledge all the work going on across the province by people in our immunization campaigns, from big communities to small communities. In Rutland this past week, we had a pop-up clinic that was successful, immunizing about 250 people in a short period of time, and we are looking at those kind of decisions strategically to address areas where we had not previously had a high level of immunization, and to increase it in the coming weeks, and public health is working hard on that. I think out in our neighborhoods this weekend, I know it was true in Renfrew, Collingwood when I was, it was pretty clear for most that it was a different sort of weekend than we've had in a long time. A weight had been lifted and a pressure eased. It was, I think, a restorative weekend for many. I want people, though, to know, and it's clear that while the circuit breaker may have ended, our cautious behavior is still very much with us and needs to continue to be. And that encouraging, as BC's Restart launched last week is, and the fact that now 69.7% of adults and 66.1% of those over 12 have received their first shot, as encouraging as all is, we have to continue to follow public health guidance and public health orders, that even though the number of cases is down, being cautious in our action and getting our shots will make next weekend even better, and the weekends after that even better and more restorative. It is within our power, but the key is, again, to be respectful of one another, to be kind to one another, as Dr. Henry says, and to register, and when you're invited, book, and get vaccinated now. There will be opportunities for first doses, and of course for many now for second doses in BC. It is critically important that we all take advantage of those opportunities and continue to increase our level of immunization. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune. Pour la première période de référence, qui s'étend jusqu'au 29 mai, nous avons eu 258 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 30 mai, nous avons eu 238 nouveaux cas. Au cours des dernières 24 heures, 212 nouveaux cas se sont ajoutés. Il y a eu 11 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 703 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 249 personnes sont actuellement hospitalisées, dont 78 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You are limited to one question and one follow-up. First question, Binder Sajan, CTV.
Hi, Dr. Henry. Manitoba today said that people there who received AstraZeneca can mix and match, and that the UK study has been delayed. So I'm just wondering, what considerations or studies are you looking at now in terms of AstraZeneca and what people should do for their second shot?
Yeah, so those are things that we talked about over the weekend with my colleagues nationally, and we'll be discussing as well. And here in BC, our BC Immunization Committee has been looking at the data that we have as well. So we've been looking at very similar things to what Manitoba has come out with, and I've said this several times that we are waiting for some more of the data. And yes, some of the immunogenicity data has been delayed from the UK, but there's also other data out there that we've been looking at as well. So I will come out with the details, but I think it will be no surprise to people that there will be options. People will have a choice, and we just need to formulate the risk-benefit in a way that people can understand. And we're also looking at the logistics and operationally how will this work in our system. So we have time. And we have time, so by Thursday, we'll have it all laid out for people so that they can make their own choice.
Binder, do you have a follow-up?
I do. And I'm just wondering also, is there any reason other than supply that someone who got AstraZeneca couldn't do like 2 doses of Pfizer or Moderna afterwards, especially if that is going to be required for travel?
Yeah, no, we don't expect that would be required for travel, and there would be no need. As a matter of fact, the data that we're seeing shows that if you have AstraZeneca and a second dose with an mRNA vaccine, it may give you even better protection. So I don't think there's any concerns. If the studies at the end of the day show that there's less protection in getting an mRNA as a booster dose, then yes, that is an option, is to have a second mRNA dose at least 28 days or so afterwards. So those are all things that we're looking at and internationally, but I don't believe there's going to be any concerns for WHO-approved vaccines in terms of restrictions on travel.
Next question, Marcella Bernardo, News 1130.
Hi, Minister Dix and Provincial Health Officer Dr. Henry. Thank you for taking my question today. I know it's been a very emotional time for many of us, and I was just hoping to ask you first off about vaccine appointments getting canceled, mainly in Fraser Health. We're hearing from a number of people that are reporting that they've shown up for pre-registered appointments to be told that there aren't doses for them and to come back later or to book again. So would you be able to explain why that's happening and what kind of inference that gives to people that are trying to book and then showing up and being told that you can't get your shot just yet?
I actually had not heard that, to be honest. I have heard that there has been concerns with the system, sending people messages that their appointment had been canceled because they had not yet been at the 8 weeks from the initial dose. So that is an issue that we've seen, and it may have been that people had booked their appointment and then it was recognized that they had not yet been at 8 weeks for dose 2. I know there was some confusion this weekend, and this is a challenge with the system that is registering millions of people. There was some, especially on Saturday, we understand there was some concerns where there was a blank screen and it was part of the system being updated. So I know there was a lot of people who sent me messages and we forwarded them on to the team. I know the call center as well had some issues, particularly on Saturday, with keeping up with volumes. So I am hopeful that those things have been have been reconciled. There's always glitches when we have large numbers of people that we're trying to put into a system as quickly as possible. But I also know that operationally, at least the clinics that I have been involved in, and we had an update again this morning and over the weekend, that we were able to move vaccine around. So people who showed up at the clinics, there was not, that I'm aware of, that appointments were canceled because of lack of vaccine. That's not an issue that I'm aware of.
Marcella, do you have a follow-up?
Yes, thank you for clarifying that, because we just weren't sure if it meant that there were lots of children showing up to get vaccinated, and that might be a good thing, that we're actually seeing more people showing up to get appointments or to get vaccinated rather than what we're seeing in the United States with people not showing up. The other question I was hoping to ask you is regarding the outbreaks that we're seeing in care homes and possibly in acute care facilities. I know there's 6 right now at care homes, but I'm hearing from people who are worried about how long it's going to be before they can take their masks off and spend time with their loved ones. But you've kind of been expressing that you're nervous about whether or not we can lift these restrictions too quickly when we are still seeing the outbreaks and the virus still being very active in care homes.
Yeah, and this is something that we'll need to take very slowly, because even with a highly immunized population, which most residents are now in our care homes, we've seen some rapid transmission, particularly of some of the new variants, and that's a concern. They are much more transmissible, and we have not yet finished second doses for all residents in all care homes, but we are working on that. And of course, we want to make sure that visitors receive their second doses too. And I know essential visitors and workers, that's been going on. But we are not at a place yet where we can take off those restrictions in long-term care homes. There is still a very challenging environment where people are in close contact. So what we need to do is make sure that people are able to visit according to the new guidelines that we have, but we need to be patient with mask wearing for the next few months, and we're looking at least to July, and then we can see where we are in terms of transmission in our community. Right now, we're at that point where we still have quite a lot of transmission. We have a lot of people immunized, but we're not at that point where our immune systems are fully protecting us yet. So we need to continue with the second doses, and we're going to, as you see, with the over 300,000 people booking appointments in the next 2 weeks, we're going to see a dramatic increase in the percentage of people with the dose 2, which is important. Right now, that's a way to increase our community protection as well. But we also need to address that there are certain pockets of communities around the province where vaccination rates are still lagging behind. And that's where we need to encourage everybody to support their family and friends to get out and be protected. It not only protects you, but it's important for your community too.
Next question, Richard Zussman, Global News.
Dr. Henry, graduation ceremonies are starting to take place now across British Columbia right through to the end of June. As more teenagers get vaccinated, could you imagine putting in policies that would allow vaccinated teenagers to have more comprehensive graduation ceremonies?
You know, this is something obviously we've talked about with our school health team. So public health has been providing advice. That's the group that meets regularly with the superintendents and the parents and the student groups and the teachers. And there is guidance that's come out from the Ministry of Education that's based on what we've provided. So there are lots of really great, important, innovative ways we can celebrate graduation this year, certainly outside within the restrictions that we have. But I leave it up to that group to provide the best advice about how to do this safely across the province.
Richard, do you have a follow-up?
I do. The province has made special exemptions for other groups. Religious ceremonies is one of them, and I know a lot of work got put into that. Would there be any thought to work with this group at the school level to potentially fast-track those Step 3 restrictions? If we're on track and they come into effect July 1st, with schools ending at the end of June, would you be willing to have conversations with those school communities about larger outdoor events potentially in that last week of June?
I know those conversations are ongoing, Richard, and yes, I don't know the day-to-day on that, but I know that those are things that are the conversations that are being had. Those groups meet weekly, so I know they've been talking about how to be able to do this safely, particularly outdoors, in the next couple of weeks. Yes.
Next question, Moira Whiten, the Tyee.
Hi, good afternoon. Thank you so much for taking my question and for your words and your expertise, Dr. Henry. My question is about last week you announced that clinically extremely vulnerable British Columbians would be prioritized for second doses. And as you know, the list was criticized as being rather narrow and excluding a number of people who are still immunocompromised, and that same week you said they may still have to continue taking precautions even as the province opens up longer than folks who are not at extremely high risk. What do you say to those people who are excluded from priority second doses but are still considered high risk, and why not open up the eligibility for second doses to a wider group of people?
So there's nobody that's excluded. We all have to take precautions, and people who are immune compromised, even if they have second doses, they still need to continue to take those personal protection measures. And that's because we're not out of this pandemic yet. But we do have a very specific group that were identified. It was over 200,000 people, so it is very broad, and it was based on clinical judgments from a wide group of experts, including cancer care and renal care, under the auspices of the Provincial Health Services Authority. So that is the group who determined who were at additional risk of severe illness from this virus. And there are many immune-compromising conditions that are not associated with that high risk from this virus necessarily, but we still need to be protected. And of course, that's all in the concept of the people who are oldest are the ones who are most likely to have severe illness or die from this virus. And so those people, all of those people, were prioritized, and they will be prioritized for second dose as well. And there is a finite capacity for the amount of vaccine that we have, but it is coming, and everybody will be able to get their second dose, people by age, people by underlying conditions, and in the same sequence as we prioritize people for the first doses. So I just want to reassure everybody, the second doses will be coming much quicker than we had to draw things out over a period of many weeks because of limited supply. Particularly in February, we had almost nothing for several weeks, but through March and April. As of the second week of May, we've now been able to ramp up. So all of those hundreds of thousands of people, we booked appointments for close to 500,000 people for second doses in the next few weeks. So yes, there's a broad group of people. Everybody's timeline now to your second dose will be compressed, and everybody will get their second dose in the coming months.
Moira, did you have a follow-up?
I do, thank you. We've been hearing from a number of essential visitors for their loved ones in long-term care that they're still having visits restricted, being told to wear a mask while they're alone with their fully vaccinated loved one in their room, and just other hindrances to effective caregiving and time together that I know you're easing of restrictions in long-term care homes into avoid. When are we going to see perhaps more provincial intervention in ensuring that these guidelines are rolled out evenly across care facilities as the province reopens? Long-term care residents and their loved ones can have the same time together that others in the province are getting?
Yeah, I know how challenging and how difficult this is, and I know Minister Dix can speak to it as well. But right now, what we are seeing in some cases is inconsistencies in applying the guidelines that are in place. But I do not believe we're in a place where we can allow for increased numbers of people visiting. Right now, the minimum is an hour, but we're hearing stories that some facilities are restricting the amount of time that people can spend with their loved ones. And so we need to increase consistency, and I know my colleagues in the health authorities are working with the over 500 care homes to try and address that. It is right now a very difficult time, and yes, we want to and need to spend more time with our loved ones in long-term care, but we continue to need to take those precautions because not everybody has their second dose, and not every vaccine is 100% effective yet. So we need to take that time and be very careful, because we have seen the outbreaks in the interior, outbreaks now in both Fraser Health and Vancouver Coastal that are still affecting our seniors and elders in care homes. Did you want to?
Next, we go to our final question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Final question, we go to Tanya Fletcher, CBC.
Yeah, Dr. Henry, we're wondering if you can clarify how many kids under the age of 18 in BC received the Moderna vaccine in error, and how concerned should teens who received Moderna instead of Pfizer as a first dose be? What should they expect for their second dose now?
Yeah, so it is unfortunate. I'm aware of about a dozen cases, and it is an error, but it is something that we don't believe is an error that will cause any clinical harm to people. The Moderna vaccine has done a trial down to age 12. And the results of that have been available very recently to our National Advisory Committee, and they are in the process of submitting that data for approval for down to age 12, and we hope that that will happen in the next few weeks. That does not excuse the fact that it should not have happened, and that the immunizers certainly need to disclose, which I understand they did to the parents and to the young people who received the vaccine in error. And we have put in more processes in our clinics to try and make sure we're not mixing up vaccines. And you can tell that it's challenging. And one of the reasons why we're very careful about where people will receive AstraZeneca as their second dose, for example. So I don't believe it's an error that's going to cause clinical harm to people, and we expect that Moderna will be approved for use down to that age very soon. And in that case, people who received Moderna will receive the Moderna as their second dose as well. I think the other thing that's reassuring to us is the National Advisory Committee on Immunization has looked at the interchangeability of the two mRNA vaccines and supports that there's no safety concerns or effectiveness concerns if you have Moderna and then a Pfizer or vice versa. So as much as we can, we will try to make sure everybody gets the same product for their second dose, and we'll make sure that everybody gets the on-label application of each product, which means right now Pfizer is the only product that's approved for use down to age 12.
Tanya, did you have a follow-up?
Yes, please. Thank you. And if we could get a response in French from my colleagues as well, for Minister Dix, to both questions, that would be great. I know you were asked this last week. I'm wondering if there's any kind of updated guidance, though, given those studies out of the UK that see the huge gap in vaccine efficiency between people who've had first versus second doses. It's less than 40% for those with one dose. So given that, if things continue to worsen in the UK, is there any possibility that restrictions might be different here for people with first or second doses, depending on if we open up further?
Yeah, so we have to be careful about looking at that. So that was a small number of people that they looked at a specific strain and whether there was breakthrough in people who had a single dose versus a second dose, particularly looking at the B1617.2, which is Actually, there's a new nomenclature coming out from the WHO that should be make it easier for us to remember all of these variants of concern, but I haven't had a chance to look at it in detail yet. Having said that, this was a small study to look at whether there was more vaccine breakthrough with this new Indian variant, and what they did find was that the vaccine is very effective against it, and particularly for people who had their second dose. So if we look at a population level, there's still very much in the UK a decreasing, slight increase, but the measures that they're taking, along with immunization to prevent transmission, are working against all of the strains, including the increasing numbers of people that have the strain from India. So we are looking at those same things here. That's why our opening is not based solely on immunization. It's based on looking at whether the measures that we have in place are continuing to work to prevent transmission. And it's going back to where we were with the basic public health work that my colleagues have been doing for 15 months now, which is case management for every single case, making sure we find the contacts, making sure we're isolating people, making sure anybody who's feeling unwell gets tested and gets reported to public health so we can support you in preventing transmission. And this is about the outbreaks we're detecting. It's about looking at workplaces. It's about all of the public health things that we're doing to test, trace, and track people to keep the virus under control, and that will continue to be really important as we increase the numbers of people immunized with both the first dose and the second dose. And of course, it is a key consideration in why we have shortened that interval for second doses. Now that we have the supply to do that, we want to be able to get as best protection we can and as many people we can as quickly as possible. So it is very much taking in all of those moving factors as we're watching the strains that are causing disease here in the province. And I will say, as we've moved now and increased our capacity to do whole genome sequencing, we will be doing whole genome sequencing of every positive case to help us understand exactly which strains are transmitting. And this is going to be more and more important as our numbers continue to go down and as people start to be more mobile and travel more, so that we can detect if a new strain that has any characteristics like being more transmissible or seeming to evade vaccine get introduced into the province. And this is something we're working on across the country. It's going to be really important as we're moving into these next phases to be able to monitor every strain that's causing infection in the province. And so that's something we're moving to as well over the next little while.
Les réponses ici sont toujours mises en anglais, je pense, mais de toute façon, on va essayer de répondre. Premièrement, sur la question de Moderna, il y avait une douzaine de cas pendant le week-end où des gens ont reçu le vaccin Moderna à tort. Et évidemment, c'est pas ce qu'on veut voir. Et des gens ont été notifiés presque immédiatement. Et en général, c'est notre point de vue, le point de vue de Dr. Henry et des autres spécialistes dans la matière, que la santé de ces jeunes n'était pas mise à risque. Et qu'on va voir de progrès bientôt sur la question de Moderna et des gens qui ont de 12 à 17 ans. Donc, c'était une faute qu'on s'efforce à corriger, mais on pense de toute façon que cela ne va pas mettre en danger qui que ce soit. Sur la deuxième question, bien entendu, il y avait une étude particulière de la Grande-Bretagne, mais cela étant, je pense que ce qu'on voit, c'est la valeur de la vaccination un peu partout dans le monde, y compris en Grande-Bretagne. Donc, je pense que ce qu'il va falloir faire pendant les mois à venir, c'est de continuer à prendre des mesures, continuer d'avoir la santé publique agir à fond contre la transmission de COVID-19. Surtout, le travail de la santé publique va continuer pour des mois et des mois à l'avenir. Et finalement, de poursuivre avec vigueur la vaccination des gens. 69% des adultes aujourd'hui, 66% des gens qui sont éligibles pour le vaccin ont déjà reçu leur première dose et on a ajouté à peu près 400 000 personnes avec des rendez-vous pour des deuxièmes doses. Donc, je pense qu'on fait du progrès, mais il va falloir des efforts pour les mois à venir pour assurer et pour surveiller ce qui se passe avec le COVID-19 en Colombie-Britannique et partout au Canada et dans le monde. Merci beaucoup. Thank you very much.